So first of all, thank you so much. Looking forward to today's conversation. I was excited when Imran sort of approached me about talking about the future of tech in healthcare, and at least what I've seen over the last day or so has been very exciting because the ideas that people are talking about here is indeed the future of tech. I believe so. Okay, fair enough. I was talk closer to the mic. Fair enough. So anyways, today I thought we'd do a quick intro of the folks here on the stage, have a few general questions to sort of kick off some exciting conversations, and then obviously open it up to questions from the group so that we can, hopefully expand the audience in the conversation. Next slide. So just a quick background on myself. My name is Ash Damle. I'm the CEO and founder of Lumiata, really focusing on how do we combine, now about 80 million patients worth of data with all that there in PubMed, with AI to really help and understand what's going on with each person, basically changing lives one future at a time by understanding the financial and clinical future for each person so that we can go ahead and price, package, and care better for them. Next slide. Shea.
Okay. Hello, everyone. My name is Shea Gregg, and I'm a practicing trauma, burn, and general surgeon, as well as a surgical critical care intensivist at a busy health system in Connecticut. And in my free time, I am the founder and president of FallCall Solutions, which our first app, as mentioned earlier, will be the first real solution and entrance into the personal emergency response space for Apple Watch and iPhone. So we're looking forward to that in May.
Great to have you here with us. Next slide. All right.
Hi, I'm Miray, the co-founder and CEO of Vivoo. Vivoo is a wellness assistant that provides personalized nutrition and lifestyle advice to people who wants to live healthier lives, like be more energetic and productive, via using a urine test. It's a 10-parameter urine test with image processing. So after you use a strip, scanning with the app, with image processing, after the analysis, our dietitians give you your personalized advice, and you can make that first step to make healthier decisions. That's it. Thank you.
Okay, so I'm the one with no slide. My name is Fahad Aziz. I'm a founder of CAREMERCE. At CareMerge, we ensure that the aging experience is filled with joy and peace of mind. We do that by providing a technology platform to senior operators that helps them eliminate the communication silos and inspire collaboration. We've been in business for over 5 years now, work with 500 senior operators and touches close to 100,000 lives. I live in San Francisco, keep a close eye on technology that reinventing, reshaping the healthcare, and I write for Forbes magazine. Very excited to be here.
Great. And so, as usual, when you have these panels, we sort of had an initial little prep call, and it was fascinating to sort of see how people here on this panel literally represent people touching the front end, the parts of coordination in the middle, as well as the back office. And so it was sort of a very almost obvious question to ask the folks on the panel is where and how do they see tech playing a role in today and the future on the front end in terms of coordination as well as in terms of the back office. So perhaps you want to start?
Technology is playing a key role, but if you look at the hospitals and healthcare delivery models, in the last 50 years, not much has changed. But now there's a lot of pressure to bring some reforms and improve those delivery models in healthcare in general. And basically, there are three drivers. Number one is that all of us wants immediate access to our healthcare data. So it's the patients that are asking for the data. Number two is the costs. So the healthcare cost is now getting higher and higher, and there are many reasons and many reasons to bring it down. And the third one is that where a lot of research is happening is in technology is how to prevent the diseases before it's too late. So those are the three drivers that we see that are driving the trends in technology and helping. So this.
Thank you. I'll comment on sort of the two worlds that I straddle. On the user side, I think that I would like to see a lot more things developed in the land of automation and simplification of UI. UI being user interfaces. This is a major issue. As you notice, if you remember when the launch of the first iPhone, by the way, I have no disclosures, I don't work for Apple or anything else, but when like the first smartphones came out, you know, we had flip phones, and those are pretty straightforward. And then all of a sudden, you have these mobile devices in your pocket that can really, that have gotten more and more complex. And I think as developers and as technology, people who are going to bring technology into the world of medicine, I got to speak closer too, which I need an app for that. I think that if we're going to do that, we really need to focus on the user interface and the user experience. Using things like automation and make things invisible until you need them, and make them very easy to access. What I see on the clinical front is the improvement in efficiencies. A lot of people have heard, if you work in the clinical setting, if you've delivered things in the clinical setting, you know, I hate the electronic health record, I hate the electronic health record, et cetera. It's really not the electronic health record's fault, it's the interface with the electronic health record that makes it challenging. How can we make that a lot more user-friendly? And this is where I see many of my colleagues not engaged with that thought process. I mean, we're building smart phrases and all these other things that we're trying to sort of improve our efficiencies. But quite honestly, there's a lot of things that you can do in the land of automation, like streamline your billing processes. You include, I mean, as you know, billing processes, I see people here, I saw your hands go up earlier as clinicians. I mean, you bill based on the amount of information that you have in a note, you know, your 99245s or whatever it is, all right? So you can easily have something that has the intelligence to look at what elements you have in your H&P and be able to actually put out that billing process so you're billing and you're compliant appropriately. Those are the things that we really need in the clinical setting, along with decision-making algorithms, bringing best practice into our care and really sort of maximizing the quality based on best practice and algorithms. So automation, efficiencies, and you know, incorporating best practice to deliver quality.
In Vivoo, our main innovation is converting the medical data or health data into a really understandable interface. So if I tell you your bilirubin level is 5, probably half of you are medical doctors, so you would understand, but everyday people, even me as a bioengineer, I don't understand. So putting there, putting there a happy liver or a sad liver and improving liver to happy one, or if it's a really bad liver, go to your doctor, making it understandable and support this structure with everyday advice, eat an apple, but because of this you should eat an apple. So in front end, we're trying to make as basic as possible, because my boyfriend asked me, my heart rate is 120, what should I do? I said, maybe you get excited, but consumers sometimes don't even understand that simple thing, why it's like this, why it's raised or something. So we're trying to make it so simple. In the back end, of course, our nutritionists, our doctors are writing all of these advice based on so many articles. There's machine learning for image processing. We're using AI, artificial intelligence, but that doesn't concern the patient's side, consumer side. So, yeah.
No, it's interesting. I mean, the way I also talk about EHRs is death by checkbox. You know, but it's interesting that almost all of you are articulating some form of where technology can help improve the interface between people and data, right? But I would ask sort of the question, still sort of playing on this question of tech's role on front end, because a lot of you talk about the interface, coordination or back office. Where else do you see it transforming? I mean, one is obviously how do we communicate, how do we interface, how data is presented to every of the different stakeholders. But beyond the point of interface, where else do you sort of see a place where technology is changing the fundamental landscape by which we can potentially deliver care?
So if you look at the technology landscape in healthcare, over the years we had some big players that were innovating in their limited space and doing great job, improving the processes, technology, blah, blah. But something really interesting happened in last year or two, which is that the Silicon Valley decided to get a little more excited about healthcare. So all the major tech companies who did some stunts in the past with healthcare and failed, this time came back, and this time they came back with much collected and approach. So if you look at Google, Amazon, Microsoft, and Apple, now each one of them has an interesting perspective and angle in healthcare, and that's where the technology is going to play a very interesting role. So if you look at Amazon, they're going for retail, they're looking at insurance. We still don't know what they're doing. It's all secret projects, but this is where their angle is. The type of people they're hiring, the partnerships they're doing, they're going to go after consumers, may offer them insurance or something like that. Apple focused on consumer. They want to make sure that when you open up the health app, you can see all the data, and to her point, be able to understand what it is. So if the blood pressure is certain, some number, Apple will tell you what that number means to you. Google focused more on AI, big data, doing a lot of research, brain diseases, and all that stuff. And Microsoft confused, trying to figure out what they need to do, but haven't figured out. So if you look at those three large players in technology, gives you some idea, some glimpse of what are the areas where technology is going to make very disruptive, or I would say reinvent the experience.
Just a quick comment. I think that, again, as our our payment models sort of embrace bundled payments, trying to keep people out of the hospital, I think that the technology has to really focus on the preventative aspects of things. And I see it out of the corner of my eye now. So
don't want to miss your
I need to like tape it to my nose. But I think that post-acute care, preventative strategies that can actually be engaging to keep people out of the hospitals, really work on these algorithms, work on, again, combining best practices into things that make it engaging, fun. A lot of these things these principles were described earlier. I think if we can keep people out of the hospital in healthy states, then we're doing our job, and I think tech has the ability to really do that because it's sitting on the hips or in the back pockets or wherever your devices are, and it really has the ability to make that impact. The scale is immense, so we just got to make it, build it in such a way that it's engaging.
Yeah, and I would totally agree that today's almost ubiquitous use of smartphones and REST creates a platform like there's never been before ever in the history. It's also interesting, as you guys were talking about, when we think about who's going to lead that charge. Almost all of you are articulating in some senses the patient, right? There's the providers, obviously, there's the payers, the patients, but also you also mentioned companies such as employers and or tech companies. So I'd just really love to get your thoughts about who is potentially going to be able to lead that charge as it moves forward.
It would be nice if the consumer or patient was leading it. I think it would be more like a clear market, but of course the payers and providers right now currently leading the market. And that caused so many problems. Like when the provider leads the market, hospitals become malls, like a shopping center. And when the payer leads the market, as you can see, so many people are in so much trouble because they cannot pay the treatment they need to take. So for the patients lead the market, we need some education so they will know what they need not like a medical education, but at least the basics of understanding about what's going on with their body and why are they taking that pill. Is it because they need it, like they can ask the doctor, or is it because a drug company just paid the doctor, so he's taking that drug? So if we educate the market with some basics, at least like some information, the market will go to in a much better place, I believe.
So I wrote down one answer here, but I'm actually going to throw my notes away here. Honestly, the real thing that should be driving this is quality, period. I think that quality care should actually be the thing that is driving this. Now, it's going to take, a village in order to be able to deliver it. It's going to have to be systems. It's going to have to be, health systems. It's going to have to be payers. It's going to have to be et cetera. I think there is a precedent and there's a real focus on the desire to do that. And I mean, to the point where we're now delivering payments based on quality through Medicare, et cetera, and a variety of other models. So I think that quality has to drive this. And we have to recognize that the fee-for-service days are going away and gone in many ways, and that quality ultimately we have to fit into that model, and we should fit into that model, quite honestly.
Do you have two more answers to this one? So actually, I agree with both of you. If you look at other industries, they are very much now driven by the consumers. And consumers decide if they want to move from Barnes and Nobles to Amazon, and that just shifts the industry. Unfortunately, it's much more complex with healthcare. But what annoys me as a consumer of healthcare industry is that I don't have any transparency, any visibility on my healthcare bills and checks. If I go to the doctor, I have no idea what's going to happen, if it's going to be a $100 bill or $1,000 bill, and so on. And I think that has to change. How's that going to happen? It's too early to know. But when the technology comes in, when these players comes in, they bring in investment, they bring in the best talent in the world, and they can influence the Washington. So they did that for driverless cars and many other things. I'm sure they can do that for healthcare. So I'm very excited that they will lead the charge to some extent, but it has to be the patients who lead this forward.
That's really interesting, and obviously most of you articulated transforming the interface, empowering the patient, right? In some sense, we think about how do we build that AI physician to empower people. What are your thoughts about where AI's role in healthcare is and why now?
So number one, obviously prevention. So if it can do early detections, like there's a lot of research going on where they can identify some signs of brain cancer much earlier and other forms of cancer. I think that would be huge. But I also agree with Shea that the workflows and efficiencies needs to improve. So if you look in a setting like health, like hospitals or long-term care, there's so much inefficiency. People are doing the same thing again and again, very labor-intensive, very little intelligence needed, but they are just doing it. That all needs to can be changed with machine learning, where the processes we can look at the bottlenecks in the process. We can see where things are working, not working, make suggestions, improve on those. That would be huge. A good example I give on that is when someone has to be discharged from hospital to a rehab center or skilled nursing, that whole process is such cumbersome. There's so much documentation that needs to go in addition to the discharge summary. They have to look which skilled nursing has a bed, which has the facility. They have to schedule their admission and discharge and so on. And a number of people get involved to do that, which can easily be done by maybe not even a smart system, but a more collaborative system. So I think the efficiencies needs to improve, the accuracy needs to improve, and AI and machine learning can play a vital role.
I'm going to give two responses which might seem like they're contradictory, but it's actually, they walk hand in hand depending on what level you look at it. I think that that AI can be very valuable when it comes to personalization of medicine, of the delivery of care, in the sense that, you know, when we look at large genomic genomic arrays, we can deliver personalized care for certain types of tumors and certain types of maybe viral targeted things to attack cancers and those sorts of things. So AI can be very valuable, and machine learning can be very valuable for personalizing things to potentially reduce false negatives or false positives, et cetera. So that's one aspect. But at the same time, so I went into trauma because, you know, I'm a very simple person. And we use a lot of algorithms. And, but it's interesting because you go between one trauma center and another trauma center, and those algorithms change, even though the best practice, you know, has been described, you know, et cetera. Interestingly, outcomes are the same, you know, very similar in a lot of regards, depending on your patient population. But it's the same thing with burn centers, you know. You go to burn centers and they do things differently. They put different dressings on things, et cetera, but their outcomes are roughly the same. But costs are going to be variable, and there's this thing called quality variation units that, you know, if you start to stray from algorithms, you can get higher variations, which could potentially increase your costs and or decrease your quality. So I think that the use of AI for the purposes of personalization in terms of, you know, specific treatments could be very useful in terms of for those people who could benefit from it. But at the same time, as people are going through treatment, care pathways, et cetera, you can get people through the system a lot more efficiently if you have best practice algorithms that eventually will lead to that very personalized treatment, where AI can actually help on both sides of that.
Why now? Because the electronic data came to that point that Watson can made a better lung cancer detection than a medical doctor now. The reason why is there was enough data, so we could train the AI, the machine, and it could understand. And there are so many examples, actually, if you want to talk about, but it all depends on data. So if we keep collecting data, I saw so many applications, like it looks at the Fitbit step data, and it looks at the Salesforce sale data, and look at those two and says, these people who makes more steps makes better sales. It's a simple example, but no human eye or a human algorithm can detect that. Those small details can only be detected with these machines that human, of course, develop. And there will be so many examples. And when we talk about the personalized aspect, I think that's the strongest point, because every individual is different. So all those small details or small difference cannot be detected by general algorithms. So here is now is the right time.
Yeah, I mean, I completely agree. We are now generating and capturing more data per unit person, 100x, than we were just even 10 years ago. And the ability now to combine that data to understand the patterns, to create that level of personalization that you both are talking to now is just starting to become possible with the computational capabilities we have, with the data aggregation and synthesis capabilities that we have. So it's a very exciting time. And so based on sort of, as we see AI, as we see sort of maybe patients and technologists and tech companies and other people really taking the charge and thinking about how the interfaces will change moving forward, what impact do you start seeing in the next 3 years or 5 years or 10 years?
I'm actually so excited because we're in a wellness space, like in a safer place when you compare it with you. I want to see more personalized services, such as I'm scanning my phone and let's say it's a kiosk and it already has my body data from Fitbit, from Apple Watch, from Vivoo, whatever there is. And it gives me a personalized smoothie rather than regular Starbucks coffee. I will get all the vitamin needs, maybe in 3 years, not even 5. And in 5, these devices will be in home, not in the general spaces, but they will be personalized. So I can create my own capsule easily in 5 to 10 years. And it will be helping a lot in the preventative aspect, especially, to get what you need to your body and get the right things, not the crowd in the internet, like top 10 things that you need for, I don't know, be skinnier or something, like you really need. So I'm really excited to see. I hope we'll all make them true.
Oh, definitely. Shay, please.
Sure. Impacts. I honestly don't know what kind of electronic relationships we're going to form, 10 years from now. I really can't even imagine because of the way that, tech is coming down and what AI and what, how we have self-driving cars, I can only imagine what's going to be. What I can say is that adoption will be, I think, more widespread in the sense. I can definitely say that. And I also want to see this extended to, again, given my interest and my background, to that elder population. Hopefully we can really build up these user interfaces to engage more people in general. And I think the ultimate hope is that we can keep more patients out of the hospital, but while giving them the care they need. And when I say care, I mean true care. And then on the other side, we can also get them through the hospitalization, which, as from our microbiologists to everyone, nobody wants to be in the hospital, and I respect that. If we can keep people out of the hospital and get them through the hospitalization experience so they can actually get to healing, then technology is, I think, that's the type of electronic relationships we need to develop.
So when none of us really like going to a physician office or a hospital. That whole experience is so painful, no matter what technology they use, the scheduling system they have. So, and if something is painful, someone will come in and fix that. So when I see it 10 years from now, or maybe sooner, most of the things that we get done on primary doctor's offices can be done at home with all these devices. They'll do the initial diagnosis, and maybe an AI system which has a lot of data about me and my family and the area where I live in, be able to do some initial diagnosis too and give some recommendations. I see a lot of exercise that happens in doctor's offices can move to houses, so that may happen. The other thing that should really happen is that we have all these ecosystems of healthcare, so the hospital systems, they all work together, but we don't have an ecosystem of ecosystems. So you can have a healthcare system in a Kaiser system in California, but they will never talk to a system in Seattle or somewhere else. And I have a personal experience when I had an accident in Seattle. I had a surgery there. I came back to San Francisco, and I just couldn't get my documentation from that hospital. They put me in a loop. And after 2 weeks of trying to get my documentation, I gave up. It's not going to happen. So I think that those silos needs to break, and they will break. Someone will come in and break them. And once that happens, the magic will happen. Because then your data, no matter where you are, you will have access to it. And all together will become very meaningful. So I'm hoping that this will happen in years to come. And we will all see the benefits of that.
Just to comment, I mean, that was the purpose of the electronic health record, right? Meaningful use was to actually be able to put everything on an electronic medium like the VA, where you have that data at every VA. And ironically, it hasn't happened.
Well,
so
one
we'll
helps
see.
with some of the new regs.
What's that?
One helps with some of the new regs from CMS that just came out yesterday, pushing on interoperability as the new definition for MU. We can hopefully see some of that. Really want to open it up right now to questions from the panel.
Questions?
Please.
I have a comment about the public health side. I have a comment about the public health side because it's really easy when you have all this data from the hospital and you're at the front end because it's all algorithm driven, like you said. That's why it's really exciting for you guys to think about AI. But the problem with AI will be this. You only have a select database. You have a select sample of people who pay for and consume healthcare. And so you have the other social determinant side. So there has to be two strategies, right? So yesterday when I gave my talk about true population health, the goal of public health system, the goal of any country is to achieve the triple aim, right? That the whole population gets the right care at the right time by the right provider at any point along their life course. And when you see figures like we saw, where someone had necrotizing fasciitis and they chopped out the skin and didn't give the recovery side of it, that's negligence, okay? There's no reason that the payer should deny payment for that. And then the question is, why is it costing so much money that we have to go to Mexico to get our care? So the triple aim is, affordable care. It's become non-affordable care. I say that the Affordable Care Act has become the Non-Affordable Coverage Act. Everyone has car insurance, but no car. Now, tell me you guys in Silicon Valley can't figure that out. Because Covered California basically is, we all have coverage, but no care. So that's the problem you have to solve. I know you can do it. But you're asking the wrong question. You're answering the wrong question.
No, that's a great question, but that's what we were talking about, that the inefficiencies needs to improve. There's, within the health plans and within the whole healthcare delivery models, there's a lot of inefficiency that's adding up to the cost. So what does it really cost me to get a surgery today versus it should have cost me is the question. And I think this is where the technology comes in. Now the problem is that there are silos. They don't open up. And there's the politics, there is bureaucracy, there is some
financial interests where these hospitals do not want to open up.
No, I understand that. So I think that especially in California, because we have such a crisis there, we really have to break down the silos to understand the problem. Like, for example, the homeless situation. The health plans have approved a diagnosis of discharge to homelessness. Well, my physician colleague there and I know there is no Medicare diagnosis called discharge to homelessness. If that patient had been ours and we discharged them to homelessness, we'd get sued. So if the health plans they have responsibility for the member, which means they have total risk, okay? So this is where you have to solve that problem, because they're not our patient, they belong to Kaiser, okay?
It doesn't actually have to be like that. So there are other examples too. Like United States is one of the worst healthcare systems in the world. I'm from Turkey, for example, and I know in Europe, no patients pay anything. Employers or government pays your insurance, and whenever you go to a doctor or a surgery, if it's for cosmetic reasons, it's separate, but if it's a necessary treatment, you will pay $0 and get your medicine and leave the place. So there are so many countries that United States system can take an example.
Yeah, I mean, we actually do a lot of work with safety net clinics in California, right? Sorry, thank you. Yes, thank you, yes. The safety net clinics, yeah, exactly. And it's towards your point, I think the understanding that the right data is not necessarily being collected is starting to become understood, right? And the understanding of how social determinants are truly creating and impactful with how someone's health actually progresses is also now starting to become understood and actually becoming of great interest. So towards your point of how technology companies, employers, and other people realize at the end of the day, we're all people, and we have to figure out things that work for everyone. And so I think I see some interesting starts. We're obviously not there yet, but hopefully if you...
Yes, you talked a little bit about AI's role with the personalized healthcare. I'm just wondering, have you seen anything being done with AI related to physician education and training, and its interpersonal relationships with maybe patients as well?
So we've done some things in the past, and this has actually been an interesting conversation of how is it through AI can you create greater simulation for practice-based learning, right? So that you can create greater numbers of scenarios that before, and they've seen this with respect to virtual surgery and how people when doing this actually perform better when they're actually then doing real surgery, right? So those are some interesting parts from that perspective. And you asked a very interesting question at the end there, I would say, is, you know, how is it that I understand how to actually influence this individual towards a better path, right? It's about also, I mean, in some sense, it comes down to how you message things, right? You could say the same exact information content, quote, quote, but you may message it very differently, and that person may be receptive to one or many of those different ways of doing that. And I think that's definitely a place, because that's a whole different skill set of how do you effectively communicate with people than how do you analyze a particular individual in terms of potential diagnosis and treatment. So I think that's a very interesting area that AI can help, and think people are now also starting to ask that question. I've actually been talking with a number of people about that. So,
Could I just ask a follow-up question? Based on your experience, I want to try to understand your question a little bit more, because personally, when I think, you know, simulation, those sorts of things, I haven't really seen a lot of AI on the front lines, you know, and I run Sim Center stuff. I've done you know, a lot of education, frontline education. But if you, where do you sort of, what do you mean by AI in the, sort of the learning space?
Well, when we work with practitioners and they're doing health coaching, we want to see how their health coaching is impacting on the patients. So based on a patient population, and as you alluded to, of course that could be different in the reception of that, you know, communication piece. You know, can we have some kind of a learning tool that helps where the communication piece between physicians, patients, or providers and patients?
Yeah.
That's where we're looking at moving towards when we look at health coaches and being able to keep them within their scope of practice, but, you know, raise them to a level where they're able to communicate and make an impact on patients. And also, of course, with physicians as well.
Yeah, I would love to see that developed. You know, I'm a CLEAR coach. I've seen the, you know, the benefits of the CLEAR program in terms of disclosures and uncomfortable situations. In terms of, you're almost speaking of how I personally communicate with a patient, and we know what the best practices are. Like, there's a list of things that you can do when you go into a room to potentially increase your Press-Ganey score. You know, you can sit down with the patient, you can make eye contact, you can, you know, gently touch them on the hand if that's warranted, or if it's allowed. You know, using body language cues. So there are certain things that you can do, and I have not seen it deployed other than standard PowerPoint presentations. It'll be very interesting to see what that interface and what that availability would be. So.
Question for the panel. You know, from a healthcare standpoint, we tend to always be inward focused in that no one else understands our industry, so we're not going to apply best practices and learnings from other industries into our own. I'm just wondering, from a healthcare and a technology standpoint, what are those key industries outside of ours that you think are ultimately some influencers that we should be paying attention to?
I am very excited that you asked that question. So I've been an academic for a while, and I think there's the academic world and then there's the industry world. There is a lot of lessons from both that both worlds can, you know, bring together and learn from each other. This was brought up yesterday on the initial talk. That's why I asked the question about academics. I think that you know, the quest for IP in the academic world, to own all the IP, et cetera, you know, as opposed to sort of share thoughts, share best practices, et cetera. I think those walls are coming down slowly, but I think we need to continue to advocate for that to happen. You know, that East and West Germany wall needs to come down. And then you've got some really great minds doing great things. So I think that needs to happen.
Wonderful. Anyone else? I can't talk today. Is anyone else? Please give a round of applause for the panel.